and teaching would suit you still less. Son, be a dentist, you'll be a success.
All right, well, if this is the way you feel about the dentist, our next guest says, think again. Routine visits are quick and pain-free, but ignoring your dental health can send you to the hospital. For Janet, putting off dental exams led to gum disease, tooth loss, and damage to her heart. Dr. James Manning with Amazing Dental Solutions Implant Center restored her smile and her faith in dentists. Please welcome him along with Janet Dorsett. Good morning. All right, so your name is Dr. Manning, but you call him
Dr. Amazing.
Dr. Amazing. All right. You get this a lot where people come in and they put things off. And if there's an issue brewing, it can be much easier to take care of early on. But if there are big problems, don't be afraid to come in.
Absolutely. That's very, very important because it's always a lot more work, a lot more things you have to go through the longer you wait.
Yeah, and that's why we have to have our routine maintenance, right, to avoid some of these things.
Catch
But
things early.
to your point, a lot of us, you just don't like doctors, period.
I have white coat syndrome.
Yeah.
That's what they have on my doctor's
All right.
records.
So you went with that. When's the first time you realized that putting it off was causing sorts of problems?
Well, I knew for years, and I tried to reach out to dentists, and none of them just seemed to be inviting. So then I had the heart issue, and I had been looking at his ads, and I called. They made me feel comfortable, and I went in. But I already had to have a heart stent.
And Dr. Manning, explain that, because there is a connection between our gum health, our mouth health, and our hearts.
That's right, because your mouth is a pathway to your bloodstream. So sometimes bacteria, if it's overloaded in your mouth, can get into your bloodstream and it can stick to your valves, your heart valves, and other arteries and things like that in your bloodstream. So then it can cause a lot of problems. You can end up with an open heart surgery in some cases if it's not contained and checked in time.
Yeah. And what ended up happening with you?
I had 2 heart stents put in, and his office and staff made me feel so comfortable that normally I take anxiety meds, but I don't have to when I go to his office.
Yeah.
At all.
Yeah.
And now I can smile.
In fact, you probably like go in for a checkup and they're like, you were just here last week, you're good. Right?
Actually, that's happening now.
That's funny. All right, so with your mouth, again, when you put it off, things happening. So what was happening in her mouth?
She had a lot of abscesses, and with teeth that are in the condition that we started off with, abscesses, your teeth are rooted in your bone, and you have a lot of blood vessels in the bone, and all those things feed the teeth. So when there's bacteria in the teeth, that goes right to blood vessels, and then it starts to carry all over your body, which is what happened to her. So we had to kind of clear out the abscesses by removing the bad offending teeth, and that's kind of what we did with her.
Yeah, and a complete mouth rehabilitation.
Yes, ma'am.
So when we say rehabilitation, what does that involve?
It involves, for the most part, with Janet's case, for instance, we had to remove all the teeth. We had to remove all the infection. We had to get her health back in order. And then we basically rebuild everything that's in there. Start off using dental implants and different types of prosthesis in there. We have different forms using titanium framework all the way through zirconia and other porcelain type setups to be able to make that.
All right, we were talking earlier in the green room how a lot of people are afraid of going to the doctor, but they also feel ashamed of neglecting it.
That's right.
And they don't want to open their mouth. You don't care about that.
Not at all. That's what you come to see me for.
Yeah.
That's why you're here. So, yes.
Let's talk about how this impacted your whole self-esteem.
It was none, but now I have a lot.
Yeah.
And he's teaching me to smile again because I haven't smiled in so many years.
Yeah, how crazy is that? That's something that we naturally do, he had to teach you to do again. So explain the moment where you got the mirror, looked in there, and saw for the first time in a long time these beautiful teeth.
I think I said Dr. Amazing real loud, and I was like so pleased. And I couldn't quit looking. It was great.
Yeah. There are a lot of people who are thinking about doing this, and they're putting it off and putting it off. Your advice to them to just go ahead and get it done, and how much it's changed your life?
It's changed it a lot. I'm in the sales industry, and I've noticed a change in that. It's increased because I can smile, talk, and have confidence.
Yeah. All right, Dr. Manning, a lot of us will look at this as an aesthetic issue, but as we just talked about, it's a health issue as well.
Absolutely.
Yeah.
And not everyone's the same. It's not cookie cutter. Sometimes it's going to be the cosmetic lumineers that somebody needs. Sometimes they need their whole mouth, the teeth pulled, as you mentioned.
That's right. Yeah. Because in Janet's case, she had both she had the health issue and she had the cosmetic issue. Being able to be confident just to do the normal things you and I take for granted, for instance, is very important. So this is where, if the health is right, if the teeth are in good health, then we can just make your smile and your self-esteem that much better using cosmetic lumineers, for instance. Yes.
The other thing that's important is to go to somebody where this is their level of education and expertise.
That's right.
So tell us about your background.
So I've been working on this for a while, for a few years, about 5, 6 years. And my whole start when I got into all of this is I wanted to create an environment, or basically an office experience that you can basically walk out and feel like you got something. You can change your life. You can do something you didn't want to do before. That was one of my primary driving goals. So I spent a lot of years doing a lot of courses and a lot of programs just to educate me on how to take a complete mouth, start over from scratch, and just work our way to what the patient really needs.
Because a lot of patients spend a lot of years kind of doing the patchwork.
That's
and
right.
you spend a lot of money doing the, kind of the bridges and the things and the patchwork that's not, dentures that are not going to give you what this can give you.
Absolutely. And I did realize with time, you would notice that when you start adding up all the different things that people have done over the years, or the patchwork that people have done, it ends up sometimes costing more than just getting it all done the right way from the very beginning, the proper way.
Yeah. All right. Smile for me again. Okay. Now she can't stop. Okay. Amazing Dental Solutions Implant Center has a special offer for Great Day Houston viewers. Call today to schedule an appointment and receive 20% off dental implants and 25% off lumineers now through February 28th. Also, receive a free consultation when you call today. Make a call to 832-408-9653, 832-408-9653, or visit AmazingDentalSolutions.com and get to meet Dr. Amazing. Right?